talking men's health with Dr. Richard Natale, a urologist and men's health specialist with Carolina Urology Partners in the Charlotte, North Carolina region. We're going to be talking about a condition today that impacts many, many men: enlarged prostate, also known as BPH. But before we dive into that chat, Dr. Natale, just remind first-time listeners a little bit about who you are, what you do, and also, why are you so passionate about this work?
Richard Natale at Carolina Urology Partners in Charlotte. I have been in this area for about a decade, a bit more than that. And I am, as a urologist, I do general urology, but also have a special interest and a focus in men's health issues. So urologic conditions that affect men primarily. So one of the areas of interest of mine is treating men who have enlarged prostate. It's interesting. When asked the question why I have this passion, I think I sort of take away my doctor's hat and put on my guy's hat for a minute and say that I think we need more advocates for men's health. I don't think guys stand up for themselves as much as we need to when it comes to this stuff. And so being able to then be a champion for them and saying, hey, I hear you, brother. I have these same things, or I understand where you're coming from. And hey, by the way, I'm also especially, skilled in this area. That really kind of, gives me a sense of fulfillment in that I picked the right job and I picked the right career to help my fellow man. So that's why I have that passion in doing this.
We're talking BPH, so a lot of men are probably going to be tuned in because it impacts so many men. Let's start out by just having you define for us, what is enlarged prostate? What is BPH? What is this benign prostate hyperplasia?
You got it. It's interesting. I think the first thing to know is that we've sort of given guys a misunderstanding of what this truly is. So we hear BPH or prostate enlargement, and guys go, oh, okay, so my prostate's the size of a watermelon. You're like, no, it's not necessarily that the overall gland, the prostate gland, is enlarged. It's just where it's enlarged. If there's excessive growth of the prostate tissue around the urethra, the P-tube, then it leads in time to constriction or compression against that channel. It makes it more difficult for us to urinate. So it's really more of a clinical diagnosis than a true physical, here's this big old prostate. Now, some men really do have gigantic prostates, and others have kind of normal or modest-sized prostates but have a lot of urinary symptoms. So understanding that first is important. The second part is to know what the prostate does and why it does what it does. So the prostate is an organ that basically helps our ejaculation become more liquid so we can then impregnate a woman. The prostate lives on the bottom of the bladder, wraps around the urethra channel. There's glands inside the prostate that throughout our lifetime respond to the male hormone testosterone and will continue to grow. Now, the time it starts, well, it varies in some guys in terms of that kind of over-exuberant growth, and it turns out that guys may have symptoms as early as their 30s or 40s and then on through the rest of our lives. And that growth, occurs pretty much until we're kind of old and gray. And that is what causes all those urinary symptoms. And that's what benign hyperplasia of the prostate is. And that's the last part, is the B, benign. It's not cancer. So guys will get really worried about it. It's not cancer. It's just overgrowth of that tissue.
Okay. But how would you know if you have it? How do you know if there is overgrowth of that tissue?
Well, I as I like to do, and I've done before with you, Casey, is I use myself as an example. I have a lot of the urinary symptoms that go along with BPH. I have weaker stream. I don't, have a little bit of what we call hesitancy, a wait to get things started. I might dribble some after I get done urinating. So it's that kind of frustration. I know, I feel it, and I've put myself on medications to help. That's usually the first sign, to be honest with you, is that idea that, oh yeah, I've heard as you get older, it's a little bit harder for you to pee. Those are some of the early signs of this. Now, of course, as always, we want to see you do clinical evaluation, rectal exams maybe in your future, unfortunately, blood tests, questionnaires, all these other things we do to help us understand that. And obviously rule out other causes of urinary troubles. But for the most part, when you're coming in, peeing on your ankles instead of peeing in the toilet, you have prostate enlargement.
Thanks, Dr. Natali. I think it is helpful when you use yourself as an example. It really is a reminder of how important it is to talk about these things, and we all, are dealing with them. So I appreciate that.
Absolutely.
Yeah. So how common is BPH?
I kind of tell folks that if we all lived long enough, I think all of us would get it. Certainly by your 80s, a good, 4 out of 5 men or more are going to have prostate enlargement. Now, the degree to which this occurs and the symptoms obviously varies in folks, but we even see in men in their 50s that up to a third of them have prostate enlargement. Now, I'm 45. My urinary issues kind of slowly started creeping in my early 40s, around 42, 43 is when I first started kind of detecting that there was a little bit more of a problem. And I'll tell you, it makes sense. Family history. I look back and it wasn't on my dad's side, it was on my mom's side. I think there's prostate enlargement issues. So kind of when you start putting that together, go, yeah, it's probably more common than what we know. Certainly, age not specific, there's probably tens of millions of men who have this problem.
Dr. Natali, tell me about treatment options, and if you wouldn't mind, I think it's helpful for our listeners if you can kind of touch on some of the risks and some of the benefits of the different treatment options when it comes to BPH.
Sure. I will start off on the easy stuff. So guideline-based, kind of, listening to what the experts say, we tend not to suggest things like saw palmetto anymore. But personal beliefs, personal habits, observations I made over the years in practice, I do think that some easy things to at least consider. You hear these prostate formulations on TV all the time. I have no problems with guys at least, entertaining that for a little while, as long as we're, of course, following along with them. That being said, if that either doesn't work, they're not interested in that, or their symptoms are fairly significant, then we start moving on into the different medical therapies that start first. There are 3 drug classes we can use. The first and most commonly prescribed are what we call alpha blockers. Alpha blockers are, actually, it's a neat kind of side story here. If you look at a medication called Afrin, which is an alpha agonist, we use it to kind of spray in our nose to open our airways when we're congested. Alpha blockers do the exact opposite. They actually will cause a constriction or nasal stuffiness, one of the side effects of the drugs. But what it does in the prostate area is it allows the muscles within the prostate to relax and allows us to urinate better. So conversely, guys who use Afrin or who use cold medications that have that type of effect to their body, who have enlarged prostate, their urinary symptoms get worse. So that medication group, the alpha blockers, helps the muscles relax, helps us pee a bit easier. Now, those drugs are essentially a blood pressure medication. So one of the side effects outside of a stuffy nose is to have, I don't want to say low blood pressure, but you might be a bit more prone to getting some dizziness when you stand, particularly if you stand up quickly. I'll give you a story about that in a second. So those are the 2 most common side effects. The third, what we report to men, is they may see a reduction in the volume of the ejaculation that comes out. When I talk to guys about that, it is because of that muscle relaxant property, essentially. Everybody knows that if you ever go to have sex and you try to go pee afterwards, it's really hard to do. That mechanism is all relaxed now, so the ejaculation doesn't stay inside of you, it just kind of leaks in your bladder, and then you pee it out after you're done. So those are the kind of main side effects, risks of the medications. But the benefit of the pills is they're very effective. They can help alleviate your troubles. Now, I will tell you, I've taken them. I had a lot of that dizziness symptom. A lot of it's because I jumped up too quick and forgot my own advice to my patients. So you can definitely get that. There's that for sure. but otherwise pretty safe and effective drugs. If those are not working well, if we need to add on to them or think about things to kind of shrink or reduce the size of the prostate, a second class of drugs is called 5-alpha reductase inhibitors. Essentially, they block the kind of mechanism in our prostate that is relied upon for growth. So where testosterone kind of gets broken down into some subcomponents, it blocks that process from happening. The tissue does no longer get stimulated and begins to shrink over time. Those groups of medications are known to kind of give you symptom relief, usually over time. So, 3 to 6 months, you start seeing clinical activity, you'll see an improvement in your flow. Most often, there's not a whole lot of side effects. However, some men will report odd things like genital discomfort, potentially erectile dysfunction, changes in their libido. It's a drug that those things are recognized in, and I do use it still, but in a very smaller minority of my patients than I had in the past. Alternatively, some men, particularly guys who have mild erection problems, actually do fairly well with using something like a daily Viagra or daily Cialis. There have been studies over the years on the use of, or men who've used Viagra on a more regular basis, and they saw that, in fact, they were reporting better urinary symptoms over the years. So using that as a therapeutic option does help. In fact, out of the 3, I chose that for myself. I'm taking a low-dose daily Cialis, and it does really does help improve my urinary flow. Like all the drugs, they have side effects also. Believe it or not, stuffy nose is kind of runs in that group of meds as well. Some people get some reflux symptoms, facial flushing, maybe some heart kind of feeling like a palpitation type symptoms. That's usually on the higher doses though, and the lower doses are pretty well tolerated. That medication, not necessarily better than the alpha blockers or the others, but definitely within that class of drugs we use to treat it.
Okay, that's great. And medication seems like it's maybe the first option there. Is there, if that doesn't work out, is there a next level that a man might then encounter while being treated for BPH?
Yeah, absolutely. Keeping in mind the idea that this is still a mechanical problem, i.e. there's just extra tissue causing obstruction. There are unfortunately mechanical solutions as well. And guys kind of get a little bit nervous when I start using those words. But the reality is that addressing the blockage and relieving it is important. So I use the analogy of Drano. And I say, well, imagine you've got a clog in the drain. You're going to use Drano the first or second time. I think it's reasonable. Everybody's going to do that. But at some point, everybody knows you're going to have to run a snake down there and clear out whatever's obstructing. So I use an example, and there are multitudes of procedures. There's office-based, minimally invasive procedures that may only take us literally a few minutes to accomplish and will give you the relief you need, all the way up to very much more invasive procedures, surgical procedures. A lot of that is predicated around the size of the prostate. So I always tell guys, when we are at that point where we need to start talking about the next steps, understanding your anatomy and then being able to use the size and architecture of your prostate to then kind of put you down the right path, what your different options are. That's really, really key. And as I said, there are some pretty straightforward, neat things we can do even in the office.
Absolutely. And of course, more information on BPH treatment available at charlottemenshealth.com. I would encourage people to visit that website to learn a little bit more. Dr. Natale, do you have any general tips for men? Perhaps it's dietary, perhaps it's lifestyle that can promote good prostate health? Because I know it's tough to say that BPH could be prevented, but if there's any just general prostate health tips that you have, I'm sure that could be helpful in some way.
Oh, yeah, absolutely. I think that, believe it or not, one of the biggest things that can help guys is weight loss. We see urinary symptoms worsening as we are heavier, whether it's just a simple matter of gravity or if there are other factors that play a role that weight loss can help. And so with that, of course, like most of our other medical conditions we all face, is that healthy eating and healthy behaviors that go along with weight loss. I tend to favor diets that are lower in animal fats and proteins, because we can see that a bit more of a fattier diet may put men more at risk, is certainly for prostate cancer potentially, as well as prostate enlargement. And I do believe that things like antioxidants, pomegranate juice, blueberries, things that are red grapes or red wine, things that are high in antioxidants do help as well. So kind of a little bit more of a holistic approach to your health. Looking at that and seeing how it can apply to your prostate, it really does help. So I do counsel guys on that as well.
Great stuff. As always, when it comes to men's health, Dr. Richard Natale has you covered. We're talking men's health, we're talking BPH, and we are talking enlarged prostate. Dr. Natale, any final thoughts for our listeners on today's episode?
Yeah, you know what? As I like to do with everybody, I try to relate, and I'm going to relate on this one especially. I get it. Whatever kind of fears or trepidations a patient has, I'm just like you. I feel the same things. I understand why the concept of a medication or a procedure is scary, and I'm facing it. And as a urologist, I get that kind of insider's knowledge about what actually happens as well. With that being said, I don't want to have that hold me back. Bladder health, I don't think people focus enough on what that means for us long term. If we sit on these symptoms long enough, some of the damage that's done to our urinary system is permanent and cannot be reversed. And so when I think about my own urinary troubles, and I go, gosh, I'm 45 now, I don't know that I want to be a 70-year-old guy that has, needs to wear a catheter or has troubles with running to the bathroom too much. So earlier attention, taking this seriously, being important, putting this up in front is an important thing for you now is very important. It's going to pay you back in the end, I promise, in a good way if you take care of it. So again, as much as I hate it, and I'm going to actually look for a urologist to do a procedure for me probably in the near future. I get it. It is what it is. We'll get through this together, and I understand it. I get it.
All right, you've been listening to Dr. Richard Natale with Carolina Urology Partners. He's a urologist and a men's health specialist. You can learn more at charlottemenshealth.com. Thank you again for your time today, Dr. Natale.
You got it, Casey. Thanks.